Hello, friends. We are in Montreal, Canada right now. I'm Dr. Ravi Paneri. I am with one of my patients, Miss Tremblay, who is an American, and she has been suffering from pemphigus vulgaris for last year and a half, and she has been taking my Ayurvedic treatments for pemphigus vulgaris for almost 4 months. She is almost 50% better now, so we'll just share a little experience of her in English language. Yes, Miss Tremblay, how are you?
Fine.
Yeah, so can you just give us a brief story about your disease, when it started, what was your first symptoms and everything?
Yes, initially it started at the top of my head. I thought it was a sunburn that just wasn't healing. And went to my dermatologist in January of last year, and he just thought it was dandruff. So I didn't worry about it. And then later in the year, around August, I had gotten a couple bug bites, which I thought were mosquito bites, and they wouldn't heal. They were itchy and they just wouldn't heal. They kept scabbing over, and I wasn't too concerned because I just thought, well, it's just some kind of strange insect, and I'll get over it. But in August of last year, I got what I thought was a spider bite, and that was really irritating. And then I got a tick bite, and then I had more spots on my back that were getting itchy and not healing. So I decided, well, I better go see a dermatologist. And my dermatologist that I had seen for my initial spot on my head wasn't able to see me till December because he's so booked. And so when I happened to go back to Colorado for a vacation, I saw my sister's dermatologist. She thought I had dermatitis and gave me a bunch of drugs to put on my scalp and to put on my skin. My scalp she thought was a fungal infection. So the results came back negative for the scalp and dermatitis for the biopsy she did on my back. But the drugs that she gave me, most of them were, the side effects weren't anything I wanted to take, so I didn't take any of those. Meanwhile, my dermatologist that I had seen in New York had an opening and called an earlier opening, and it was just 2 weeks after I saw the dermatologist in Colorado. So I went to him, and he said, no, I think it's a different disease. I don't think it's dermatitis, and I think whatever you have on your scalp is the same stuff you have on your back. And he sent out two different cultures to do two separate labs to confirm that it was what he thought was this pemphigus, and it's called Bullous Pemphigoid.
Mm.
And so his recommendation was drugs, to do prednisone, and that would take care of it, and I might have to be on prednisone the rest of my life. And that wasn't a very good option. I didn't want to do that. And so that was in November, and it pretty much, my disease stayed the same. I just kind of ignored it. I didn't have that many spots, and I read a little bit about pemphigus, but thought, well, this isn't a big deal. I'm sure they'll heal up and go away. But in January, I had changed my diet for about a week. My brother came, and he's really big into onions and garlic. So after a week of severe onions and garlic, my skin really, the spots started exploding on my back and on my front of my chest. So then I realized it was getting serious, and I had a spot moving towards my eye, so I thought I better do something. Oh, and I have to back up for a minute, because in December, after doing some research on the internet, I had seen that there was a doctor in India that helps pemphigus patients, but I thought I have no way to get to India, so I kind of let that go. And so in January, my dermatologist convinced me that if I took prednisone for a couple weeks, it would be pretty much gone, and I could come down on my dosage and I would be fine in a short time. So because my eye looked like it was in danger of getting pemphigus in it, I decided I better try the prednisone. So I did the 50 milligrams for 2 weeks, actually 3 weeks, and went to see him, and he said, well, that hadn't really changed anything. He wanted me to go to 75 milligrams, and I just said, no way, I'm not doing this drug. I can feel the side effects of it already, and it's not healthy. So I contacted my regular doctor and asked him to help me do the reduced doses, because my dermatologist didn't seem to want to do that. He wanted me to go up, he didn't want me to come down. So my regular doctor gave me the sequence of coming down off of it. Meanwhile, I contacted the guy I'd seen on the internet, Dr. Ravi Paneri, and asked if he could if he could treat me, if he treated a lot of patients, and could he treat me over the internet versus going to India, because I didn't want to go to India, and he said he could. So it was probably, by the time I finished my prednisone and started his supplements, it was now April. I'd gotten his supplements through the mail. I ordered them through the internet and started his program in April. And after starting it, even for the first week, I have to say that I could see, I actually felt less, I wasn't just on fire. Before that, I I was just hot all the time. I could hardly stand it. I was going outside in the middle of winter with no coat on. I was like, just to try to cool off. So anyway, in the process of starting his diet and then his pills, and I don't know which one had the most effect for sure, but I could tell right away that I wasn't so hot and I wasn't so heated up, and I really wasn't getting very many spots anymore. Or if I got a spot, it was a little breakout, and it would heat, it put a scab, and it would heal and be gone. It didn't continue to blister like the other old spots had done. So I saw changes, and I've continued to see changes as time has gone on, and I felt better. So it's been 4 months now since I started, and I feel significantly better. All my spots aren't gone, but the minor ones that I got after I started his supplements have really made a difference. They're just gone. My older spots are still healing.
And you feel less itching, right?
Oh, a lot less itch. Oh yeah, that's the other thing. Besides feeling like you're on fire all the time, is itch. You want to itch constantly, something somewhere. So the only part that I have that's still itchy sometimes is I'll notice I'll be itching my scalp. That's where it's itchy. Most of the time my skin isn't itchy. I really don't have any itchy.
So overall you feel around 50% better, right?
I'd say at least 50%, yeah.
Yeah, in 4
better.
months.
Yeah.
And you are following the strict diet and regimen as prescribed, right?
I am.
So what kind of foods are you avoiding as such?
I avoid all citrus, all meat, all dairy. Well, you didn't say dairy, but I pretty much don't do dairy, but you didn't say that. So I avoid fish, chicken, and all kinds of meat, and all citrus fruits, and vinegar. That's a big one because I love vinegar on my salad, so no vinegar. And that's pretty much the things I'm pretty much eating. I've done these diets before where you eat pretty bland food, and that's what I'm doing with rice and vegetables mostly, and some lentils, and occasionally beans.
Okay, all right, thank you.